Hi, my name's Adam D. Simone of Medicare with Adam, and as a licensed Medicare broker, I wanted to share with you the two main questions I get from virtually everybody I deal with. And if you stick around to the end, I'll give you the bonus question that most people are actually too afraid or too nice to ask me, and I'll give you the answer to that too. Number one question I get dealing with hundreds of people who are on Medicare, many of which I helped get on Medicare who are new to Medicare, either turning 65 or retiring from a job and losing work insurance, is do I have to sign up when I turn 65? Now, the answer could seem a little complicated, but it's really not. If you have work insurance, you typically do not have to go fully on Medicare. Now, there are some exceptions where when you go on Medicare, if you're at a company under 20 people, where Medicare will end up being the primary. But for most people I meet with, they do not have to go fully on Medicare Part A and Part B if they're still working and have work insurance. Now, the caveat to that is you want to compare benefits and prices, because sometimes it still makes sense to do it even if you don't have to, but you will not be penalized. If you keep creditable coverage, which work insurance is, it's Affordable Care Act insurance, you're not going to be penalized when you then go and retire, say at 66, 67, 68, even 70. I've met some people who've done that. You're not going to be penalized when then you do fully sign up for Medicare. You will most likely just get Part A to start with and continue to pay for and use your work insurance if that's what you prefer. So that's question one. You still want to compare it, but no, you don't need to sign up for Part B. The second question I get all the time is, should I do an Advantage plan or a supplement? And that's a more nuanced question, because that really comes down to the doctors that you see, the doctors that you want to see, and then also the medications that you take, how important extra benefits like maybe dental and vision are to you, and what's your budget. So everybody's a little bit different. Not everybody's going to have the same exact health conditions or the same exact doctors or preferences. I do both. I'm licensed and certified to do both, and I don't necessarily have a preference. I think there's pros and cons to everything that you go with. Medicare supplement, you typically pay more up front, but then get less bills on the back end. A Medicare Advantage is the opposite. You typically pay less upfront in a monthly cost or a monthly premium, but may have co-pays, deductibles, co-insurance on the back end. For some people, that's still fine because they're already used to that. Some others would prefer to have it all paid for them and pay more upfront to do that. Again, no right answer. That's why it's important to consult with somebody. And on that, I'll give you the answer to the third question, which many people are too nice to ask, is how do I get paid? Do I have a fee for my consulting? And the answer is yes, I get paid, but no, I don't charge you. So that's not how I get paid. And if you're talking to anybody regarding Medicare and they're trying to get money out of you directly, I would turn the other way. I get paid directly by the insurance companies that I'm contracted with and represent. So if you sign up for a Medicare Advantage plan, a prescription plan, a supplement, I get paid by that insurance company. Now, my commissions are standardized, so I don't get paid more by one company than the other. Do I have preferences in companies that I've worked with for over a decade? Yes, but I'll tell you why that is. A lot of times it's their customer service. It's how they offer benefits and maybe change benefits year to year. But I want you to be happy, because the longer you're happy, the longer I remain your agent and the longer I get paid. So if you're unhappy with your plan, you will switch to another agent who calls you, who asks you about what plan you're on and gives you ideas that I didn't give you, and you'll switch with them, which I don't want. I want you to be happy on your plan, and I want to continue to work with you. Now, you will pay the same whether you use my help or whether you go on the internet and do it yourself, whether somebody from a call center calls you and you sign up. So there is no additional charge for you. So my services come to you essentially free to you. You don't have to pay extra for your plan to use me. And I'm a resource year after year. So as your health changes as your needs for healthcare change, as your prescriptions change, I do annual reviews with all my clients who want them. Some people say I'm fine, nothing's changed, and that's okay. But many people have had changes in their medications or their needs, and they want to sit down and do a review. I do that for anyone who wants one every year, and we just make sure that you're on the right plan for you for that year. So if you are new to Medicare or if you have any questions at all, please reach out. You can reach me via email at adam@medicarewithadam.com, or you could just message me directly through Facebook. Thank you.